I'm Lucas and I'll be presenting on ADHD. I'll be going over how it's diagnosed, the different types of ADHD, its cause, and the different treatments, and how I think it's relevant to you guys. So, what is ADHD? ADHD stands for Attention Deficit Hyperactivity Disorder, and it is a disorder which causes inattention, lack of focus, and impulsivity. You might know it as ADD, or Attention Deficit Disorder, but this name is now outdated because it only describes one type of ADHD. According to psychiatry.org, it's one of the most common mental disorders. So most of you probably have friends with ADHD or at least know someone who has it. So how is it diagnosed? Well, a diagnosis is based off of symptoms occurring over a period of time in more than one setting. So for example, symptoms can't only be present at home or they can't only be struggling with symptoms at school. To receive a diagnosis, a person has to be showing 6 symptoms of ADHD, or only 5 if they're 17 or older. There are 3 types of ADHD, and the type that someone is diagnosed with is based off of symptoms they are exhibiting. The 3 types are primarily inattentive, primarily hyperactive, and combined presentation. Combined presentation is a little trickier to diagnose than the other 2, but I'll get into that in a second. So the first type is primarily inattentive, and it's what it sounds like. So someone with primarily inattentive ADHD mainly has problems focusing, staying on task, and organizing. Symptoms include avoidance or dislike of tasks that take sustained mental effort, being easily distracted, problems with time management, and problems completing tasks. The next type is primarily hyperactive, which is, again, what it sounds like. People with this type struggle with hyperactivity, or basically they struggle with constant movement. So symptoms of this type include having difficulty staying still in their seat, excessive movement, fidgeting, or cutting into conversations they're not part of, or having trouble waiting their turn to speak. And then the third type is combined presentation, which is just someone who has symptoms for both of the other 2 types. The diagnosis of this, as I said, is much more thorough than the other 2. It involves a psychiatric evaluation, complete family and medical history, questionnaires, and extensive questions about their childhood, their education, the environment they grew up in. And the reason this process is so extensive is because other neurological disorders can easily be mistaken for ADHD, such as mood disorders, substance use, and the use of some medications. So, what is the cause of this disorder? Well, the exact cause is not known, although a lot of evidence suggests it's genetic. There are some, however, biological differences we can see in children who have ADHD versus children who do not. For example, children with ADHD have less gray and white brain matter. Other factors that have been linked to ADHD are stress during pregnancy, low birth weight, and exposure to substances. So, how is it treated? Well, ADHD is considered chronic, so it's not treatable. It's not curable, but it is treatable through therapy and medication. According to the Child Mind Institute, the most common medication for people with ADHD is stimulants, which increase dopamine production in the brain. Methylphenidate and amphetamines are the main stimulants used. They're used as ingredients in medications. Adderall, Ritalin, and Focalin are more short-acting medications, and they last about 3 to 4 hours, while something like Concerta or Adderall XR are longer, lasting about 8 to 12 hours. And these are really good for children who are trying to get through a school day, for example. But not everyone reacts well to stimulants. So for those who can't take stimulants because their body doesn't react well, there are medications that have clonidine and guanfacine as a base. And what these medications do is they lower high blood pressure. These medications are very short acting and typically require a few doses a day. So, how many people have this disorder? According to CHAD, Children and Adults with Attention Deficit and Hyperactivity Disorder, in 2022, about 3.5% of the population has ADHD. 3.5 sounds like a small number, I know, but what that comes around to is 11.5 million people living with ADHD in the US in 2022. In conclusion, ADHD is a complicated neurological disorder which many people misunderstand, or at least they have an incomplete picture of how it works and what it is. It can be difficult to diagnose because of the different types and the complicated nature of the disorder and the way it can be similar to other disorders. So why should you guys care? Well, you probably know people who have this disorder, friends, classmates, and being able to understand it is really crucial to being able to understand those people properly when you're interacting with them and to be able to conduct a good relationship with them.